Hello, very excited to welcome you all to today's session. This is our fireside chats, preparing for 2025, how employers and health plans can rise to a pivotal moment in healthcare. My name is Manny Vega. I'm on the team here at Truven. And again, very excited for this conversation. We're talking amidst a really crucial moment in healthcare. As you all know, lots of things going on. We've got rising healthcare costs across the board. That, of course, leads to rising premiums. For employers, many of you out there, it's harder to be able to offer great benefits at a manageable cost as a result. And then on the health plan side, we're talking about things like provider consolidation, workforce challenges, new emerging therapies and drugs and technologies that are there to consider as well. And so as we meet today, as we discuss these topics, the key question really, as we see it, for employers and health plans as they build their strategies for 2025 and beyond. How do you trust that you're making the right decisions on the best available information? And so that's really what we're here to talk about today. And it's really what we're all about here at Merative. It is a big day for us at Merative, as well as many of you might have seen already. Had a few announcements today. First, launching Truven Health Insights to market. This is our healthcare analytics platform, which is really meant to address the needs that I just described for all of our employer and payer clients. And as part of that, we're reintroducing Truven as one of our 6 distinct product lines here at Merative. Many of you probably know the name Truven. It's been known in this industry for many years. It is really a leader in healthcare data and analytics. And that'll definitely be the case going forward, but now with a really enhanced and modernized platform to address what customers need. So you can learn more about all of that, our announcement today, by visiting the link at the bottom of the page here. It's merative.com/Truven. There's also a QR code there that you can scan with your phone. It will take you to the same page. And finally, on LinkedIn, we've got the Truven by Merative page. If you follow that, you'll get the latest updates from our organization regularly here on LinkedIn. So this time, I'll introduce our speakers. First up, we've got Jeff Rivkin. He is Research Director for Payer IT Strategies at IDC. And he's really an expert on all things payer business, payer technology, priorities and trends, keeping his finger on the pulse of everything that's important to this space. So I'm really glad to have Jeff available to us today to talk. And we also have Gerry McCarthy. He is CEO here at Merative, and he will talk about the work we're doing with our clients. A lot of great examples of client work going on right now here at Truven, helping a lot of our payer and employer clients stay ahead of those challenges that I described before. And so first question is just, really around today's announcement. Obviously, a lot going on here at Truven. Do you want to expand a little bit on what we're announcing here today?
Sure. Let me take a step back and talk a little bit about Merative and why we were formed 2 years ago when we carved out 5 solutions from IBM. First, Merge Imaging Solutions for PACS, cardio, and hematology. Zelta, a clinical trial platform. And then Curum for government social services, eligibility, and enrollment. Micromedics, which is a familiar brand to many of you on this call, representing clinical decision support and primarily in the pharmacy world. And then lastly, why we're here today, to talk about Truven, providing real-world data for employers, employees, and payers. We executed on a very clear strategy to separate, stabilize, and grow these businesses. We've invested significantly in talent, technology, and workflow to build upon these trusted solutions to the delight of our customers and the market. It's been a tremendous amount of work, and we're really proud of the results. This strategy has worked. Today is an important day for Merative as we announce the relaunch of Truven. First, we've invested tens of millions of dollars in the new release of Health Insights, which is focused on workflow and self-service, allowing our clients to easily drill down and create their own data insights. One of the great things that our customers have loved for decades of this solution is our highly curated data. And now we've made it much more accessible in a workflow-friendly fashion. Secondly, we're returning to the Truven name. The market knows and trusts Truven. It's proven. We're on a path to growth, winning back clients and signing new ones. Our strategies and investments are working, which is exciting for all of us because we're ready to help clients at this critical moment in healthcare. Jeff, welcome back. What trends do you see in the market for health plans and employers as they start to think about 2025?
Thanks, Gerry, and congratulations on your Truven announcement and the 2 years at Merative, actually, the anniversary. Yeah, the trends are there's a lot of them. Always for payers, the first thing top of mind is the idea of mandates, right? So price transparency, interoperability, prior authorization. That's always top of spend for payers. And that needs to be mentioned first whenever you're talking about where payer spend is going, payer trends are going. A more interesting concept of what's going on is individualized benefits, personalized products. The idea that product of Jeff, if you would, moving towards a more personalized approach to healthcare and a personalized approach to benefits. We're not quite there yet, but as you've seen in the auto industry, for example, you see where you put the little thing in your car and you can have pricing based on how you drive. We're moving towards that in healthcare and in benefit packages for both employers and individual market. One of the things that runs in with the mandates and the trends in general is the interoperability mandate. That was a game changer. The idea that, payer to payer, payer to patient, payer to provider, we're trying to get the idea of that having put this data on the edge and let organizations get to it, distribute it, and have it eventually be the point where we will carry around our health record on our phone, regardless of where we go to get care. We're not there yet. We've got a long way to go. But the interoperability mandate, which happened a couple of years ago and is still evolving with the use case of prior authorizations, caused a situation in the back office for payers. And what happened was what people thought was going to be a little fairly small project to put member data on the edge became a bigger project because they realized the data they were about to put on the edge for Member 360 was not accurate. So now these Member 360 projects sort of spun up, and a data platform concept was sort of necessary, so that the data, which was usually in a lot of these silos across the organization, was sort of at least consolidated, understood, and stewarded, so that the data they did put on the edge was accurate, matched up to the right person, cleansed, versioned, and ensured that there is an accurate version of Jeff on the edge, if you would. What that drove was the data factory approach, which was the ability to ingest a lot of data about Jeff or all members and take in all kinds of data, labs and social determinants and all kinds of person data, so we can get a legitimate Member 360, truly accurate. And that's the difference between a lot of solutions out there that don't pay attention to back office, don't pay attention to the factory, don't pay attention to the curation of data. There's a differentiator when you're looking for platforms. And that's the big trend I've seen is this concept of Member 360. You can't have Member 360 unless you have belly buttons put on the data, authoritative sources through stewardship and guardianship, meaning putting belly buttons on tables and entities and files around the organizations that understand where this data is created, where it's used, where it's updated, and when it's deleted. This concept of master data management has been around a long time, but now with interoperability, which exposes bad data for what it is, and AI, which is, again, you have models and data, you've got to be able to have data that is accurate before you can put models on it, regardless of how good the model may be. If you got bad data going in, you're going to have bad answers coming out. These are the trends I'm following here at IDC. And Gerry, what are you hearing about from your health plan clients?
We're hearing a lot of the same, Jeff. To meet these challenges, our clients really want to know and focus on three main questions. Number one, am I basing my benefit decisions on the best data available? Number two, is the foundation of my decisions rock solid? And number three, am I presenting the best information and data to my leadership with demonstrated ROI? Truven's really focused on delivering what you've hit on. It's the trusted data and analytics piece. We really have to specifically focus on few key areas. Number one, we really have to utilize what you've referred to here. It's the primary data set, and our primary data set is closed claims, and that's highly differentiated in the marketplace. Secondly, we have to get after the curation of the data, which I think you talked about really well there. That curation, making sure that things are in the right format, it's high quality, it's not garbage in, it's not garbage out. You can turn around and make sure that this curated data is giving you access to the insights that you need. On top of that data, it has to be enhanced. We add things like groupers and classifiers and predictive models to make it relevant to the study and what information you're looking for. Then that data needs to be benchmarked, performance against peers, and making sure that all of that data is accurate against that peer data set. And then lastly, organizing that data, high level visualization and capabilities to dig deep. That's what this new release is that we're talking about here today. Our clients are sophisticated with their use of this data. Our data and analytics can enhance that in-house expertise. And when necessary, we bring world-class data scientists and services to the table to help for those unique scenarios where you have to go dig deeper into the data to really understand what it means.
Can you give me some examples of some of your health plan clients and what they're doing and how they're using your tools to do decision making?
Sure. We've got a great client base representing some of the most progressive clients in the world. We work with 40% of the top Fortune 100 companies, and 7 of the top 10 US health plans utilize our solutions as well. There's a lot to choose from, but let me take you through one in particular, Penn State, which our CFO, Brian Bonner, loves because he went to Penn State. He's all things Penn State. They've been a client for 8 years. They utilize both our Health Insights and Benefit Mentor, which is actually a tool for the employees of Penn State. They have a shared governance model, multiple internal stakeholders on those benefit solutions and decisions that need to be made, which we find more and more with these organizations and our clients utilizing that shared governance model, and everyone has to have access to these insights. They use this data to drive decisions like claims analysis to evaluate provider performance, supporting negotiations with providers and vendors, lab cost analysis to point employees to local labs with the best value and quality for the right cost. And something that's really been front and center in the news lately, GLP-1s, benchmarking that cost and utilization to inform off-label use strategies to save money while their employees can turn around and address weight management for themselves and their families. In addition to the data informing decision makers, Penn State also provides Benefits Mentor to their employees to help them select the benefits that make sense for them and their dependents based on their own personal health history and financial history. Anecdotally, they tell us that they've had encouraging results, both clinically as well as financially, supporting conversations with their vendors to make sure that they're getting the best possible care for the best value. Lots of clients are out in the marketplace looking at GLP-1s right now. This is a trend that's emerged quickly. Jeff, are you seeing this trend in the market? What other trends are you seeing in the market?
Yeah, it's expensive. Obviously, an area that is caught the national news, the world's news, and the ability to use these things off-label to do things that weren't quite intended to be done in the first place. Mm-hmm. Any discussion of trends in this space has to talk about AI a little bit. AI, the AI answers are only as good as the data you put in. And yes, a lot of people like to see the bright, shiny object of the AI model. And, people talk about ethics and bias and quality of the models and learning models. But the essence of the argument is the data. You can have the greatest model, perfect, non-biased, ethically wonderful, totally inclusive and equitable. But if it's put on lousy data, you're going to get lousy results. Not as much press goes to that, and it should. If your data set's this big, you're going to get one answer. If your data set's this big, you're going to get another answer. If your data set's this big, you're going to get another answer, and all those scopes better be good. So that's number one, which goes back to that platform discussion I talked about earlier. A little bit of slowing in AI right now in payer. I think there was a big boom. Payers have sort of kicked back a little bit on it. Mostly because there's been a couple of organizations gotten burned by just doing some things that a little aggressively. And healthcare is a funny thing. We all get that sort of oogie factor about our healthcare data. It's not like retail data. I don't really care who knows where I buy my socks, but when you start talking about my personal health data and whether I'm going to, what conditions I may or may not have had and what kind of drugs I may or might be taking, people get a little oogie. I wish I had a better term for that of being an analyst, but oogie is the best I can do. The other trend that's going on is this idea of payviders, right? The idea that health insurers and health systems are coming together, whether buying each other or working together in joint ventures or just agreements across the industry or across the region, maybe health information exchanges. A lot of models where payers are trying to, they've only done what they do. They've done what they can do with high deductible health plans and premiums, and now they're saying, I got to get up the value chain. I got to start attacking cost of care because cost of care is killing me. I'm not allowed to, get the rate increases I need. The states aren't letting me do that. So I've got to attack something. So they're going up the value chain and really attacking cost of care and partnering with providers, not necessarily always doing steerage necessarily, but trying to work together in value-based situations or even just contracts that have shared savings or shared risk, so that organizations can work together and we can attack this cost of care. And that's the only way payers are going to survive. What are you seeing with trends there, Gerry? What are your trends? I'm interested to see what your perspective is.
I'm glad you mentioned price transparency. This is an area that a lot of our clients have turned to us for as well. The insights we deliver are not just for benefit managers to make the right decisions. It's also critical to provide data and information to their employees to make the best benefit decisions that factor in their financial and access to information. The best companies offer insights into their offerings for their employees. Interoperability continues to be talked about without achieving a ton of traction. And I think it's great that we legislatively went there. However, I believe data can bridge to drive data insights in both quality and cost. That data that you continue to hit on in your comments here, Jeff, is critical to driving it. And before interoperability truly is achieved, having that highly curated data across these systems where we can put it into one platform and solution to really drive those insights is just going to be critical moving forward. Lastly, we're also working on Gen AI. Of course, that's all you can read about today when you talk about technology. We have developed use cases that improve access to our industry-leading curated data and content. It's the foundation of our approach to ensure that our AI projects deliver value within regulatory and ethical standards. And I think you articulated that very well. It has to be utilized in a very cohesive way that the patient, the employers, and all of the providers are accessing that data that they should be able to have access to. And as vendors, we have to make sure that we hold to that ethical standard. We're comfortable with being second to market with technology like Gen AI that's in its infancy. We'll be deliberate in its implementation to make sure we are being excellent stewards of our clients' data moving forward. It looks like we're coming up on time here. Manny, I'm going to turn it back over to you.
All right, excellent. Thank you both. Really appreciate the conversation so far. And as we mentioned at the start, we wanted to leave some time here at the end for audience Q&A. So we're going to take it right about to the bottom of the hour here with some Q&A. Before we get into that, wanted to thank you as well, the audience here for joining. Really appreciate your time and insights. And as a reminder, if you're looking for more information about the announcement we shared today, anything about Truven, the link is right here at the bottom of the screen, merative.com/Truven. You can also use that QR code, and you can follow Truven by Merative on LinkedIn. That's where you can find the latest information about our portfolio here. So I'm just going to read these questions in order as I've seen them come through. This first one I'll direct to you, Gerry, and it's from Joyce. And she's really asking about point solution vendors, right? And I know that's a topic that we hear a lot from our own customers and in general in the industry here. But what is Truven doing? What does Truven do to help organizations better understand their ROI in different benefits programs and with their vendors?
Well, first off, thanks for the question, Joyce. It is one of the biggest questions that we get from our employer clients. How do I know the program I've invested in is actually working and delivering the outcomes that I expect? And if you look at our top 5 programs that we really focus on with our top clients, it's really these: diabetes management, next is weight management, the third is employer health and wellness. Fourth is actually jumping up on fertility programs, not just for female. There's a new emerging spotlight on male fertility as well. And then lastly, mental health. We work with vendors and our clients to design a thoughtful and unbiased measurement strategy. We want to know 4 key questions. Are the right people enrolling in programs? Are there barriers to enrollment in these programs? Why are my programs working, or why aren't they working? Am I receiving the expected ROI for these programs? And as we talked about earlier with Penn State, we know that we're achieving these with these customers by giving them that highly curated data and insights. When we can help clients answer these questions, it provides the confidence that they're spending money in the right place and can build trust between employers and their vendors.
Excellent. Thanks, Gerry. Appreciate that. Jeff, I'm going to direct this next one toward you. It's a question from Peter, and he had asked about is AI healthcare credit score. I guess that goes back to what you were talking about in terms of personalization in healthcare. Is there anything more you can kind of elaborate on that topic with?
Yeah, I think the idea of a risk score or a health risk score, somewhat like a credit score, is absolutely out there. Whether or not a particular payer publicizes that they do such a thing, they do. There are even some vendors who will say, let's work backwards from that credit score and do a lot of analytics and data gathering and things like that, targeting this thing. Yes, you have a health score in your head. You do. We are not allowed to underwrite in the individual market anymore. But effectively, that's what we were doing, right? We were saying, given the data that you've given me, what are my risk situations? And that risk situation is the basis of insurance. And whether you are understanding that is really what you have or not, you are going to be rated effectively. Maybe not priced, because you can't not allowed to do that with underwriting anymore. But absolutely, these analytics are going towards these idea of personalized care, understanding gaps in care, understanding next best actions with regard to health. All these things are based on either an urgent need for care, or an overall perspective on you as a person and as a customer. The same way, you have gold, silver, bronze customers in retail, right? Whether you're in Amazon Prime or whatever. You have ratings as a customer. Yes, in healthcare, we have ratings of you as a customer and as a patient. And the idea of personalized healthcare is to be sensitive to these ratings and give you what you want. Why would I have, paternity benefits or mammography benefits as a 64-year-old man? Why would I have that? I wouldn't. I'd rather have, some kind of wellness facility that might give me tee times for golf, right? Why not? I'm walking, right? That's a good thing. So we're again trying to personalize healthcare, personalize benefits, so that we can not only give healthcare that's better targeted for you, but give you benefit plans that pay for that that's benefit for you. So yes, absolutely, Peter. We're going to that. Have had it, and it's getting finer and finer and finer in its granularity. We used to talk about cohorts of people. People like me. No. It's people are me, and that's how it goes.
I appreciate that, Jeff. This next one I'm going to direct toward Gerry. So this is Dennis from Michigan State University. He wants to know, what's our current approach for training health insights? Anything you want to say about that, Gerry?
Yes, so it's actually transformed as we've come with this new release out into the marketplace. So we have a great services team that we traditionally bring to the table to help drive many of those insights in the reports. And while we still have that component and how that's driven, we also have the services organization that helps drive and navigate the workflow and the insights to turn around and drive the drill down capability within those reports. So it's a typical train the trainer, and how we manage that is through the same exact support team that has been working for decades with our clients. So we can transfer that knowledge set to them so they can have a higher level of self-service.
Excellent, Gerry. Thanks so much. Appreciate that. This next one I'm actually just curious about personally. I think I'm going to send it your way, Jeff. Obviously, it's a big year. It's election season, all that. Bound to have sort of impacts on this space as well. And so just curious as someone who's keeping an eye on the market, do you have a view on the election or any sort of impacts that may be facing the payer space?
Well, my crystal ball's in the shop at the moment, but the election this election is probably not as significant to healthcare and health insurance as other elections have been. The Clintons, both Bill and Hillary, back in 2016 and earlier, when single payer and nationalized healthcare might have been on the table, that was a concern, a significant concern. to the health insurance industry. I don't think we're there. I think that maybe the deficit or various other things have sort of taken that off the table. So whoever might be the president in November doesn't concern me that much, except how it trickles down. And at the federal level, that would be trickled down into the Federal Trade Commission with regard to mergers and acquisitions, and into the CMS with regard to the mandates. Now, CMS sort of runs itself regardless of the administration. They, a little aggressive here and there depending on the flavor of the day, but they've been pretty predictable and pretty aggressive for years with regard to the mandates they put on payers. Medical loss ratio, ACA, obviously through Obama. Now we see price transparency, interoperability, prior authorization. I mean, these things are at the regulatory level that sort of perk along regardless of the president. What is interesting, I think, in the mergers and acquisition space, there is some difference between big business and small business, or big government and small government perspectives with regard to mergers and acquisitions in general. However, the recent Optum and Change situation where Change Healthcare sort of showed that if you get too big, that affects too many people, might have just clouded the waters regardless of who's president, and maybe a president who would be more encouraging of less antitrust situations would probably be overwhelmed by what happened recently with Change. So that's probably going to take that away. The last thing I'll say about any kind of election is that remember that the state is very important to every insurance company. The state insurance commissioner is probably the third most important person in the state. That the regulations on insurance are more voluminous than on airlines. So, and you've got 50 versions of them. So when you're doing analysis of any kind of legislative, regulatory, or in general executive branch situations, make sure you look at the state level and all those states that any particular health plan is selling plans to. So that's a short answer. I could do this for an hour, but in general, look at all those levels and all those grains: federal, state, regulatory, legislative, and executive.
Yeah, I appreciate that, Jeff. I know it's a lot to cover, so appreciate your answer here. So we've got about a minute left. I'm just going to finish off on a question here for Gerry before we wrap up. This is actually from someone on the team here. Is there a particular feature in the new version of Health Insights you're most excited about? And in general, your perspective on Merative. What are you most proud of past few years here?
It's interesting. I'll actually tell you, I won't give you my answer because I think it's more important to have our client and end users answer this. And I've been talking with the people who've been helping us build and design this in our client base. And the first thing that they always say is the best component of Health Insights is the curated data set. Hands down, for decades, that has been the number one driver of why this has been number one in market for us for so long. But on top of this, now having that highly curated data in a format that can be navigated and then drilled down into further insights that can be saved and shared across the team within one workflow, bringing together that highly curated data set with the workflow is really the win of what this new release has been within the marketplace. And we're looking forward to getting that out there to all of our customers and our future clients.
Awesome. Appreciate that, Gerry. That about brings us to time. So I'm gonna call it there. Thanks again to both of our speakers here. Really appreciate it. Rare opportunity to hear from our CEO and one of the top minds at IDC at the same time. So appreciate you both for making the time here today. And thanks to everyone who joined us here this afternoon. Again, if you're looking for more information on Truven or our announcement today, you can visit merative.com/Truven. The QR code in the bottom corner of the screen here, or the link that we dropped into chat. So follow us, Truven by Merative, on LinkedIn. And again, thank you for your time. You have a great rest of your day.
Thanks, Manny. Thanks, Jeff.
Thanks, Manny. Thanks, guys.